afternoon, everyone. I'm Ruth. Okay, let me use this. Yeah, and I'll be talking about the Brave Arts intervention, which I'm actually very excited to talk about. The Brave Arts intervention I think this was the first time I actually became a co-investigator on a funded project from Grand Challenges Canada, and these are my co-authors with Isaac Olufadewa, the principal investigator on this project. So in Nigeria, we have about 358 psychiatrists, and then Nigeria is a very populous country with about 20 million people, and it's estimated that at least 1 in 4 persons will suffer a mental disorder in their lifetime. Also, those psychiatrists actually work in specialized tertiary hospital settings or in urban areas. And so it means that those who live in rural communities, hard-to-reach environments, internally displaced person camps often do not have access to mental health intervention and services. And so this was why the Brave Art intervention was designed. Now, a brief background again to the Brave Art intervention. More than a decade now, there was actually this Boko Haram and insurgency attacks in Nigeria. And then so people had to flee from their hometown, especially the northeastern part of Nigeria. And the government actually gave them, some kind of settlements in places like Abuja, that's the capital of Nigeria, and then other places too. And what happened was they just had the settlement, they were staying there, there were no really specialized mental health care services. And so for Slum and Rural Health Initiative, our first time we actually had conversation with them was actually in 2019, where we actually go to those camps, and then we do a form of mental health education, play games with them. We had volunteers playing games with them. And then it was through these interactions that we actually discovered that, these guys were actually experiencing symptoms of depression or post-traumatic stress disorder. And so 2021, when an opportunity for a funding came, we actually felt the internally displaced person camps, that's New Kuchigoro and Durumi camp, was actually the best place to actually pilot this project. So this is actually a pilot project. So the pilot project took place between April 2021 and 2023. And what we had was that we actually worked with young people. So it's a community-based intervention which leveraged a tax shifting model. So our beneficiaries, what we did was that we identified community leaders in the community, religious leaders, people who were well respected in the community, and then we trained them on delivering basic mental health support services, recognizing mental disorders, having to know when to refer if occasion arises. And then also the target beneficiaries themselves were young people aged 10 to 24 years who had lived in the IDP camp for at least 1 year, who were literate in either English or Hausa, and then who from the prevalence study that we did had mild to moderate symptoms of depression, generalized anxiety disorder, post-traumatic stress disorder, and substance abuse. So this is what the Brave Art intervention looks like. Yes, so it's community participatory, tax shifting approach, and when we had a friendship tent. Now we called it the friendship tent because we actually had this refurbished cargo container. Let me see if I have a picture here. Okay, all right. So the picture down here, that's actually the friendship tent, and then on it has the inscription, "You're not alone," which passes a message to those in the community to let them know that they actually can talk to community members who have been trained to seek for help. And then also we actually developed a curriculum, the Brave Arts Mental Health curriculum, which is available on Simbi Health mobile app. You can download it on your Google Play or App Store. Yes. And so this Brave Arts curriculum had sessions on mental health literacy. So this was used to teach the intermediaries, people in the community, to identify mental disorders, know what mental disorders were, and also how to provide basic care, group therapy, basically. So these sessions were now delivered in the friendship tent. Now, a unique part of the friendship tent is that it's also solar powered, because in Nigeria, we have challenges with the stable power supply. Yes, exactly. And so we wanted a place where there would actually be no unstable power supply, so it's actually solar powered. The group sessions take place in there. We have two friendship tents, one in each camp, one in New Kuchingoro camp, and then one also in Durumi camp. So this is what the Simbi Health mobile app looks like, and then that's the Brave Arts mental health curriculum on the mobile app. So in total, we trained 60 persons, that's 25 females and 35 males from the two camps. And then at the end of the training, using the mental health literacy questionnaire and also recommendations from community members, we actually selected 10 people per camp to actually serve as what we call community mental health therapists. So those 10 people, that's 5 females, 5 males per camp, 5 females, 5 males per camp, we're actually involved in providing basic mental health information and services in the camps. So from the prevalence study that we did earlier for prevalence of mental health disorders, depression, anxiety disorders, PTSD, and substance abuse, we actually identified 100 people who actually had mild to moderate symptoms of this, and then 5 persons were actually attached to one CMHT using a gender non-combined approach. So it meant that one male CMHT had other 5 young people, male also, another female also had 5 young people, also female. And then we did this taking into consideration the gender framework that actually exists in northern Nigeria. So these are the social. So at the end of it, we had 83 of them who actually completed the sessions, the 18 mental health sessions, and this actually is a table showing their social demographic characteristics. Then at the end of the intervention, the pre-post test, we observed that it was reported that 69% of them demonstrated significant clinical improvement in depression symptom severity, and then 60.2% demonstrated a significant clinical improvement in their GAD symptom severity. So what this actually has shown us is the fact that with the Brave Arts intervention in the internet displaced person camps, young people now have access to mental health information and services because they know they actually have trained people in the community who they actually can speak to without not having necessarily to visit the hospital. One challenge we also actually found out was the fact that because in relating with some of them in the community, there were actually people who had severe cases and then they needed to be referred. But our study didn't cover for that because those who were referred, they actually didn't visit the hospital. I mean, that's because of funds too, also, because they also claimed that they probably didn't even have transport fare even to get to the nearest neuropsychiatric hospital. So how much more even the money for the treatment itself. But then we catered for those who had mild to moderate symptoms, and then this helped lessen the burden of mental health care services on tertiary institutions and also ensure that more young people receive mental health care early enough. So this actually was a pilot study in IDP camps in Nigeria, and then also for further studies, we are also looking at scaling up to other IDP camps in Africa and also looking at possibly also a school-based model too, because we actually are concerned about preventive mental health care and also before it gets to the severe stage of mental disorders. So in acknowledgement, I want to acknowledge the funding from Grand Challenges Canada and our global mental health partners in funding the study. Clear that there was no role of the funding body in the study design, data collection, analysis and writing of this abstract. Then ethical approval was obtained, and then we have no competing interest. Thank you.